George Kilpatrick, Inspiration for the Nation, celebrating people we feel good about. So in Onondaga County, we keep hearing about cases rising, cases falling, cases rising, cases falling all across the country. Some communities are reintroducing mask mandates. Some people are getting rid of them. So I've invited my good friend, Dr. Sharon Brangman, who is a distinguished service professor at the Upstate Medical University, chair of the Upstate Center for Excellence for Alzheimer's Disease, and she's the chair of the Department of Geriatrics, and on and on and on and on. She got a lot of titles, but she is my go-to person when I want to talk about COVID-19 and where we are today. So I was sharing, I'll get to my situation later on, but Dr. Brangman, we've heard about new strains and new variations. Where are we right now, as of the time of this conversation?
So yes, the virus is still circulating, and the virus is very contagious. And the more it circulates, the more it has a chance to kind of mutate and change up on us. So there is a new subvariant now that is making its appearance in New York. It is very contagious, but the best way to protect yourself is to get fully vaccinated. And if you're eligible for a booster, get a booster. If you're eligible for a second booster, get the second booster. The people who are getting sickest are generally the people who have not been vaccinated or have delayed getting their booster. The other group of people who are getting sick are those people who we say have a weak immune system. So these are people who may have heart disease or lung disease, or maybe they smoke, or they have kidney disease, or they're overweight. Also, if they're older, like over the age of 60 or 65, those are people whose bodies may not respond fully to a vaccine, although they should get it still, but those are the people who may get sicker. So what I'm telling my patients is to get the vaccine, get the first booster, and then if you're at least 4 months out of getting your first booster, get that second booster.
Because a lot of people are really, I've heard people very hesitant about getting that second booster. And I know you have seen that and heard that. Can you help us to be clear about why it's okay to get that second booster and what the hesitation seems to be?
Well, I'm not sure why people are hesitant, because I think basically we're all sick of this virus and we want a booster that is good and lasts forever.
Right.
And unfortunately, these boosters do get weaker over time. And it looks like after about 3 or 4 months, the level of protection starts to go down.
Mm-hmm.
So if we're in the middle of a highly contagious virus still circulating, you want that extra layer of protection.
And let's talk. Oh, go ahead.
I understand why people are kind of tired of it. I am too, but the virus is not tired of us yet.
And you say that extra level of protection, which means that you're not going to be as sick as if you didn't have that extra level of protection. Because even if you have all of the shots, you can still contract the coronavirus. Because, yeah.
That's very true. So what we're seeing is that people who have had their full set of shots and their booster are still testing positive. But most of those people are not getting very sick. So they may have a cough, they may feel a little achy, but they're not going to the hospital and they're not in the ICU. So we have to remember the number one thing that the vaccines and the boosters do is they keep us out of the hospital and keep us out of the ICU. Unfortunately, they don't keep you completely from getting testing positive and getting the virus. They can reduce your chances of it, but they can't make it 100%.
I've seen you in Wegmans, and you are not playing. You are not playing. And this is well after the mask mandates have been lifted and all of that. I saw you, and but many of us have gotten relaxed. We're not wearing masks. We're just not doing that. We're going out, we're doing all the social things. I've been out, I've done social things, and you just don't know. And I'm usually one of the two people, my wife and maybe the other one, who may be wearing a mask. It might be 99 to 1, right? But I actually, with all of that protection, I tested positive not too long ago and had a very mild case because I had the 3 shots. But what about so we're sort of in this never land because people are tired of it, but at the same time, we're still spreading it.
So indoor air is a big source of infection. And that is still a concern, especially if you're sharing indoor air with people who are not vaccinated or who are positive. So that means you're willing to take a chance of getting the virus if you're sharing indoor air with someone who is not vaccinated or has tested positive. And if you have anyone in your family who's high risk, the best way to protect them is to keep your mask on when you're indoors. So therefore, you can keep them a little bit safer.
Even in your own homes.
So if you are living with an elderly relative or somebody who has cancer and they don't go out, but you go out, I think it's important to wear a mask when you go out to help reduce that risk. Now, I had a patient who he was in his 90s and his kids didn't believe in testing or wearing a mask, and they brought the virus home to him.
Oh.
So it's a very real thing. I know we're all sick of it, but there are still members of our community who will not do well if they get this virus.
And it's so hard to convince people people they feel they just don't want to wear masks. So we don't have a mask mandate now in most places here in Onondaga County, to your chagrin?
Well, personally, I'm in the health field, and so I see people who are sick all the time. And to me, wearing a mask is a very minor inconvenience compared to what we can do to keep someone we love from getting sick.
Yeah. I was like, I've got all kinds of, the people, and then what kind of mask you should wear. Obviously, it's, in other words, Dr. Brangman, we just have to remind ourselves. Okay, let me ask you this: the virus is still out there, but is the pandemic still out there? That's my question.
Yes.
Okay, right?
The pandemic is still going on.
Right.
Well, the pandemic means that there is a virus that's freely circulating across the world. And although in this country we've had 3, maybe even 4 vaccines, there's still a lot of people in the world who haven't had 1 vaccine. And we know the virus can hop on a plane and be here in no time at all.
And
so it's not over. It's not over yet.
What about the antimicronal treatments, and what is that, and how effective is that? And is that something that you endorse?
So yes, if you are in a high-risk group, that usually means if you're over the age of 60, or if you have a serious medical problem like cancer or heart disease or kidney disease, and you're fully vaccinated and you test positive, then there are some oral pills that you can take that are antiviral. And there's also an IV treatment with some antibodies you can take. So you would check with your doctor or your nurse practitioner or whoever that you see who's your healthcare provider, because you need to take these therapies within about 5 days of getting sick. There's a very short period of time that's available to take these. So if you have any symptoms or signs of a cough or a fever or not feeling well, you want to get tested right away because you want to take these antivirals within that 5-day window.
And the antivirals, they increase your antibodies, and how do they affect the duration and the impact on the virus in your system?
So the antivirals attack the virus. And so by attacking the virus, they make it weaker so that you shouldn't be sick for such a long period of time. And it should keep you from getting very sick.
And the time of incubation, it used to be that if you were exposed, 10 days isolation. Now it's 5 days if you don't have symptoms, right?
Yeah,
Talk to me
it
about
gets
that.
very confusing, and most of my patients are just totally confused.
Mm,
So if you have not had a vaccine, or if your vaccines are not up to date, and you have close contact with somebody who's COVID positive, you should stay home for 5 days, and you should get a COVID test on that fifth day.
mhm.
If you're COVID negative, then you can leave your house but wear a mask for 10 days. If you're COVID positive at that point, then you should isolate yourself and stay home for 5 days. So that is the way to go. If you have had a vaccine and you're fully vaccinated and you had a booster and you've had contact with somebody who is positive, you don't have to isolate yourself. You should wear a mask as long as you have no symptoms, and you could test yourself on day 5 to see if you're positive.
Okay. Now, if you have tested positive, here's the other thing. And I know we were talking about this earlier. This gets into the weeds. If you have tested positive, there was this belief that you have these antibodies that, quote, prevent you from reinfecting. Can you clear that up for us, please?
So no, if you test positive again, if you've had the virus before, or if you're fully vaccinated and you test positive, you can get this virus more than once. So
Mhm.
it's not going to prevent you from getting it. But if you test positive and you have no symptoms, that means you feel perfectly fine, but you're positive. You can wear a mask and you don't have to isolate yourself or go into quarantine or anything like that. If you have symptoms and you test positive, then you should call your healthcare provider and try to get an antiviral within that 5-day window if you fall into a high-risk group.
Wow. So your advice to us is to continue to wear masks wherever we go, especially indoors, because we don't know what the air is. Where was I? I was at a big conference this past week, and I was at an event. I was like, whoa, okay, this is a lot. And most of the people were not wearing masks. I was kind of in and out. I wasn't, because then you have when you're eating and then you take the mask off. And so there's also all of that. So I can tell you that I just want to be safe. I want our families to be safe, and I want us to be able to protect those at risk. And our community, let's talk about Black folk. Do we still have vaccine hesitancy? Do we still have all of those things? And Dr. Brangman, for people who can't see you, as a Black woman, would you please speak to that?
So this virus has had a very bad impact on the African American community. And there are still some people with vaccine hesitancy that for some reason they just are afraid to get the vaccine, or they don't want to get the vaccine. Those are the people I'm most concerned about, because if they get exposed to COVID, they have the highest chance of dying. And even if you don't die, when this virus is in your body, it can hang around and cause damage for months and months after you are no longer sick.
Mm-hmm.
So there are people now with COVID brain, where their brain got some inflammation from COVID, so they're not thinking clearly, or they have permanent lung disease or heart disease. There are people who have even gotten diabetes for the first time because of COVID. So dying and being in the hospital isn't the only thing that can happen. You could recover and have what's called long-term COVID or long COVID, which continues to give you a lot of problems. There are some people that have so much fatigue, they can't really work. So especially speaking to our community, to our African American community, it is really, really important to get vaccinated. The vaccines are safe. They work. They can keep you out of the ICU. They can keep you out of the hospital. And even if you do test positive after you have the vaccine, the chances are much higher that you won't get very, very sick. So it really makes sense for us to get vaccinated. And also because many African Americans have jobs where they're really exposed to the general public all the time. So that means day after day, hour after hour, you could be getting exposed to this virus. And with no protection at all, you're just waiting for a bad outcome.
And you talked about some of the long COVID systems, and you a lot of the folks who had it early before the vaccine, they're anecdotally, I'm saying, you are hearing about long haul, very difficult symptoms because there wasn't a vaccine when they got it.
So exactly, people who got COVID in the very beginning before there was a vaccine, some of those people are still suffering with the consequences of COVID. It affects their heart, their lungs, their kidneys. There are people who have had kidney failure, or they've had significant blood clots and other problems. So this virus is really no joke. And that's why I would encourage everyone to get a vaccine. And if you're fully vaccinated, go ahead and get the booster. There are things out there that we can do as an individual and as a community to help us get through the other side of this pandemic. We all want to live to see the other side of this pandemic. But if you're not taking these basic precautions, then you're likely to have a very bad outcome and you will not see the end of this pandemic at all.
What is the strain that's out now?
So I think it's the BA2, but there's a substrain of that, and it's got more numbers after it. It all gets very technical. But what happens is whenever this virus has a chance to jump around from person to person, the virus's goal is to live long and thrive. And the way it does that is it changes itself each time so that it can get more contagious and it's more easy to spread.
Will everybody get COVID eventually?
Well, I really hate to hear that because that sounds like we're just throwing up our hands and we're not even trying. And there's good public health evidence that we could keep everyone from getting it, but it really needs the cooperation of the public. And so it's really up to our own public will. And I know everybody is tired of this. We are sick of hearing about it. We're sick of every tragedy that's going on in the world, and this just seems like another one. But everyone does not have to get this. It is not inevitable.
It's not. You want to make it clear that it's not inevitable because that's basically what the narrative is. Well, everybody's gonna get it. So why? Because I have seen people who are very careful getting COVID, right? From somehow, some way. And what about Dr. Brangman? We didn't talk. You're obviously a physician, and you care for older patients, but we didn't talk about the vaccine for younger people, and because the theory is that they can recover quicker. What would you say to that?
Well, there's all these little sayings that don't necessarily come out to be true in real life.
Right.
So I have seen big, healthy-looking people get floored by this.
Right.
And I've seen fragile 90-year-olds get a mild case and do okay. So I don't think there's any rule. I think people make up stories to justify their inaction or their actions. So that's all a fairy tale.
So if children are eligible, get vaccinated. Everybody who can. Your thing is everybody who can get vaccinated from 5 up, right? They don't have it.
5 up. We're waiting to hear about for children from 6 months and less than 5 years old. But if everyone got vaccinated, this virus would start to have a hard time settling in on people. And then it could be less infective and contagious. The other thing is that this is a different strain than the one that first started out in 2020. It's much more contagious. So you can't wear a cloth mask. You
at all. Don't even do that.
You have to wear an N95 or a KN95. But what I see is so many people with their nose showing or with the mask under their chin. And they get it because they're not wearing the mask correctly.
I'm going to demonstrate, right? So you see I have it here. And I guess I should put the other, let me just, so I've got this mask. This is a KN95 mask. So I'm gonna put this on, and I just broke, which is another problem. They break. So
Well, yeah, they're man-made, but you want to have a tight seal. So I see people put it on and then they don't push that little metal piece tight around their nose.
right, okay. So you got to do this with the
So
metal
you
piece,
have to
right?
squeeze that little metal piece
So it
so
can
it fits
stay.
tightly across your face.
Okay. And,
Otherwise, you can have gaps, and that's how you can still get infected.
all right. So if I sound muffled, it's because I do have on the N95. Okay, which one is this? This is the N95. This is the N95. There is a little metal thing. I squeezed it, and lo and behold, my glasses aren't fogging up. And so,
So that's a hint. If your glasses are fogging up, that means you don't have a tight seal.
right. And so
And
this is the recommended mask. What about this? Okay, let me show. I gotta. This is like show and tell here. So that was the N95, the preferred mask. All right. So now there's this. These are what you see a lot of these, right? Very, very mass produced. Now I can tell you when I put this black one on, I don't feel it's as tight as the other one, obviously. But so what do you think of this?
so I wouldn't wear that one.
You wouldn't wear this one.
I would wear that on top of my N95
Ah,
to
okay.
help my N95 last a little longer.
Got you. Got you.
But
Okay.
I would not wear a cloth mask because there's too many gaps.
And this is not, this isn't, well, is this cloth? This is like, I guess.
Some sort of fabric.
Yeah, it's some sort of fabric. Yeah.
But it could potentially have a lot of gaps depending on the shape of your face.
Right.
And it may not have that little metal piece to squeeze around your nose to make a tight seal.
That is the key.
Sometimes I will wear a blue surgical mask on top of my N95 to help my N95 last a little longer.
Got you. Okay. Anything else we should know about COVID-19, the coronavirus, its variants? What we should be doing around the CDC guidelines here in Onondaga County, and the fluctuations in case we were on a bad streak at one point. We were like the highest in the state in terms of new cases.
In the country.
In the country.
We want to be number one when we're watching SU play basketball.
Okay, not for COVID.
Right. We don't want to be number one when it's COVID. Yeah. So the message is get vaccinated. They're safe. They're effective. They will keep you out of the ICU. They will keep you out of the hospital. Get a booster.
Yeah. And if
get a second booster if you're eligible.
If you're eligible, and speak to your healthcare provider. And let's we got work to do as a community, and I'm so glad you came on, Dr. Brangman, to help us to understand it. I always say a trusted advisor. You know, we talk about folk that we trust in our community. Here's a trusted advisor, Dr. Sharon Brangman, chair of pediatrics, distinguished service professor.
Geriatrics, old people.
What did I say? I didn't say pediatrics.
Pediatrics. I'm on the other end of the spectrum.
Maybe it came out muffled. I know you're not working with the babies. Chair of geriatrics. Maybe I got it mumbled anyway at Upstate Medical University and many other titles. But we trust her as a trusted voice in this community. She wants us all to be safe. So let's recap for people. Get your vaccination, get boosted if you're eligible. If you do test positive and you're eligible, get the antiviral treatments. Is that what we call it, antiviral?
Right,
yep.
Antiviral.
Yep, and one more thing we should say.
Avoid large crowds without a mask.
Large crowds without a mask, and
indoors.
Mask up indoors. And mask up indoors because you're not sure about the circulation of the air.
With the right mask.
With the right mask. And here it is. It's the N95 with the little metal piece because it clips. And no one said anything about that clip. Thank you for telling us that. Because you know, people just thought, oh, the clip is there, But, so this COVID update is what we needed, and we really appreciate you. Dr. Sharon Brangman, Upstate Medical University, geriatrics chair. Inspiration for the
Thank you,
nation.
George.
Thank you.